Congratulations, you are turning 65 this year. That honestly is a great milestone to achieve. Now, right now, you're probably receiving so much junk mail and so many flyers about you turning 65 and also about Medicare. And within all those mail and all those flyers, there's probably a few confusing letters from the government trying to explain to you what Medicare is, but it actually makes you a little bit more confused. You don't need to feel that you're confused. Medicare is a complex thing if you're not trained or if it's something new to you. The most important thing to remember once you turn 65 is that you have a timeline. And once you understand the timeline that you're in, things will start to be a lot less confusing. My name is Kervin Crawford Lewis. I am the founder of Pure Life Health Insurance. My goal is to make it simple once you turn 65 and the steps into you getting your Medicare without getting any penalties or fees. Okay? Now, the first things first. In order for you to get your Part A and your Part B, you have to get in contact with the Social Security unless you are receiving Social Security prior to turning 65. There's a few ways to get in contact with your Social Security Administration. One of the ways is by calling them at 1-800-772-1213. You could also visit them at www.ssa.gov, your initial enrollment period. When it comes to your initial enrollment period, you have 3 months prior to your birthday and then 3 months after your birthday. A word of advice, if you want your policy to begin on the same month of your birthday, make sure you get to enroll 3 months prior to your birthday. So if you enroll after your birthday, your policy will begin the following month on the 1st. I want to briefly explain to you what you're signing up for. Now, when it comes to your original Medicare, that's going to be compromised of your Part A, which is your hospital insurance, and your Part B, which is your medical insurance. Okay. Now, original Medicare covers 80% of your medical needs. Okay. Now, that other 20% will be covered by either a Medicare Advantage plan or a Medicare Supplement plan. Just to go over this a little briefly, a Medicare Advantage plan combines your Part A, your Part B, and your Part D in order to cover the 20% that you're responsible for. Also, you need to enroll into your Part D plan, which covers your prescriptions and medications. Okay. Now, with Medicare Advantage plans, they bundle all your benefits together, your Part A, your Part B, and your Part D, right? And these also usually include your dental, your vision, and your hearing. Now, the catch is you generally have to work with a certain network of doctors, and also you will be responsible for your copays and your co-insurance as well. Now, the other way to cover the 20% after you're enrolled into into Medicare after you turn 65 is through purchasing a Medicare supplement. These supplement plans are usually accompanied by a letter. For example, Plan G or Plan N. To briefly sum this up, is that you pay a certain amount for your premiums, and this will take care of everything, including your co-insurance, your co-pays, your surgeries, your lab works, and so on. Okay, you don't have to face these co-payments or co-insurance at all. But the catch is it does have a higher premium compared to Medicare Advantage plans. Also, these Medicare supplement plans, you won't be responsible for purchasing a separate prescription drug plan, which remember, that's your Part D. Okay? Now, also, I want you to take note. Medicare supplement plans do not come with dental, hearing, or vision. Just to let you know, there is no best way to do this. It's only your way. The things that fit your budget and the things that fit your lifestyle.